So over many years, I have had several different projects funded by the MPN Research Foundation. And, initially a lot of those projects focused on the genes that we know are the key causative genes of MPN. And in particular, we focused on JAK2 and calreticulin mutations in those genes that we know initiate and cause MPN. And then over more recent years, we've increasingly been looking at the mutations that co-occur with JAK2 or CalOR and are associated with risk of progression of MPN, progression to myelofibrosis or even progression to leukemia. And then what we've been also doing is integrating, genetics with basic clinical and lab parameters, but now also with bone marrow pathology and trying to identify things in the bone marrow that could be detectable early in the course of the disease by standard techniques and could be used as predictors of progression or biomarkers of MPN. And ultimately, what we're most interested in is what we call actionable biomarkers, biomarkers that not just are predictive of risk of progression, but biomarkers where we could intervene and block whatever pathway is activated to prevent progression or even prevent ultimately the development of MPN. I think the other incredible strength, of the MPN Research Foundation is their ability to bring together multiple investigators, from across the United States, but also from across the world, and to put everybody in the same room or on the same Zoom call. And really that fosters interactions and collaborations. And then the last part is that they also bring together people from the pharmaceutical industry, which of course are also incredibly important to this whole endeavor.